Hello, everyone. So my name is Alice, and I'm a rising sophomore at Duke, double majoring in global health and public policy. I would like to start off by thanking Professor Courtney Van Houtven, who has joined us on call today, for her mentorship and guidance this summer. I'll be presenting on the implementation process of a caregiver skills training program. This summer, I collaborated with a team at the Durham VA to support the nationwide implementation of Caregivers First, which stands for Caregivers Finding Important Resources, Support, and Training. It features 4 core classes that teach hands-on skills, self-care techniques, provides guidance on seeking resources, and more. This program was developed to address that while 5.5 million people in the United States are informal caregivers for veterans, about half of them report gaps in skills and an unmet need for training to meet the veterans' needs. Additionally, caregiver burden and stress are linked with poor quality care provided for the veteran. Here's an overview timeline of Caregivers First. After curriculum development from 2010 to 2011, an RCT at the Durham VA Health Center found significant improvements in caregiver and veteran experiences of VA care. Given these positive outcomes, the program is now endorsed as a strong practice by the National Program Office of Caregiver Support. It is currently being implemented at 8 VA sites across the United States. So we're currently in the multi-site implementation phase and slowly entering into the national implementation phase. So my primary role in this project was assisting in the development of implementation materials. So after initially reviewing the 40-page implementation toolkit, I proposed the idea of module overviews to allow for a more easily digestible access to the toolkit's contents. And this toolkit was developed to assist the program coordinators in implementing the project. So this slide features 2 out of the 8 total modules in the toolkit. And I also developed these action plan checklists to ensure that the facilitators and the coordinators completed all of the necessary tasks to move on to the next phase. After hearing feedback from a VA site currently running the program, the team agreed that forming these checklists would help make the implementation progression more efficient. And the checklist for each module will follow its respective module overviews in the toolkit. My other roles involved proofing the existing materials and compiling and editing the instructional videos that will be provided and distributed nationally to train the program coordinators. One key challenge for this program implementation process has been the shift to virtual delivery due to the coronavirus pandemic. For example, adjusting the toolkit content to account for virtual delivery, as well as addressing the ongoing concerns about delivering those core classes virtually. In the policy context, we hope that there will be greater attention to the key role of caregivers in a veteran's care and anticipate future healthcare policies and efforts to integrate the care of caregivers with that of the veterans. Aside from the VA project, I've also been working with teams at Duke to work on research for COVID-related studies, the first being state case studies, looking at the policies and practices in long-term care facilities in 13 US states and seeing its impacts on the number of cases and deaths in those facilities. And secondly, working on looking at analyzing visitor policies on SNFs, again, similar to Dana's project, alongside Professor Bristana Kaufman to see whether no visitor policies had a clear impact on the cases and deaths in nursing home facilities. And one key challenge was the varying degrees of criteria for these policies and the different levels and development levels of reopening and also those visitor policies. Additionally, there's the factor of reliability in the available data and data quality, especially with recent developments in the CDC now lacking full access to coronavirus data. However, we've been working with outside non-governmental data sources such as through the Kaiser Family Foundation and others to find the best data out there, though remaining cautious about the quality from all sources. Again, I want to thank my professor, Professor Courtney Van Houtven and the Margolis Center for this amazing opportunity. I've learned so much about project implementation, the policy context of caregiver supports and VA services and functions, and also all of these valuable skills that will be applicable in the future. And I'm now open to any questions.